I was cutting the towers.
All right, so first correct question of the semester. Oh man. So here's how this works. Give you a piece of paper, you're going to write your name and the number 1 on this piece of paper. If you can answer the question correctly, you get 2 points. All right, at the end of the lecture, I'll hand out another piece of paper, you can have another go, and if you answer it correctly, you can have 1 point. Okay? Alright, so the question is, what's the word that we use to describe a drug or a chemical agent that causes abnormal development? Let me say it again. What is the word we use to describe a drug or chemical agent that causes abnormal development in a fetus? Since we're doing prenatal and infant growth.
Can we get that one more time? No, I'm not getting blue.
Marijuana?
What is the word used to describe a drug or a chemical agent that causes abnormal development in a fetus? Don't be doing that.
Can we take a wild guess?
Can you say it one more time?
What?
Can we take a wild guess, like?
Yeah, take a wild guess.
One more time.
What is the word that we use to describe a drug or a chemical agent that causes abnormal development in a fetus? That's because she wasn't here on time. You didn't even bring me one, so how am I supposed to let you off? Gee. All right, hand those forward, please.
I didn't write nothing.
Read it right.
I'm just gonna put marijuana.
Pass them forwards.
Right there. Number 1.
It's not. It's all about prayer.
I just put marijuana.
Thank you.
You put
Thank you. Oh, I know. Silas.
crack. I put marijuana.
You guys are funny. All right. So, well, let's find out then. Okay, so we're going to look at growth and development. Today we're going to look at prenatal and infant, and then on Tuesday we'll finish that off and we'll look at growth across childhood and into adulthood. All right? So the key concept is that the rate of growth from conception through infancy is way beyond anything else you see for the rest of your life, right? The amount of change that occurs during the first couple of years is unbelievable. And obviously that impacts the kinds of movement skills that we see and how we see those skills develop across that time period. And most of what we see happening with that age group is driven by your genetics, right? But it is possible for outside factors to also influence growth. And as we look at adults, we see outside factors, culture, lifestyle choices play a big role, right, in what we see happen with aging. So we have a couple of patterns that we see. We've got universality. All humans grow in reasonably the same way, right? We have a growth spurt when we're very young. We tail off during early childhood and our young years, and then we hit puberty. We have another massive growth spurt, and then as we get to adulthood, we tail off and flatten out. All right. So we have this pattern that's very universal, very predictable for humans. But obviously, huge amounts of specificity, everybody's different, right? People grow to different heights, people have different bone girths, people have different muscle mass. So although the overall pattern is the same, individually we all do something different, and we do it at different times. Not everybody goes into puberty at the same age. Girls don't go into puberty at the same age as boys. All right? So we've got all this individual variation going on. And that means that we have to understand that if we're going to be responsible for helping people move appropriately. All right? We've got to know what's going on with their growth so that we can make a task developmentally appropriate. So, we're going to start with prenatal because everything that comes later started there, right? So we should start at the beginning of the picture. And mostly genetic, but there is some sensitivity to external influences that can get at the baby via the mother. Okay? And those external factors can be positive. Mum could be very healthy, she could have a good diet, she could take great prenatal vitamins, she could have a very nice calm life and not be stressed. Right? She might live somewhere that's healthy, where there's not too much pollution, or vice versa, those can be negative. Right? Mum could be unhealthy, she could have a very poor diet. She might live somewhere where pollution levels are very high. Okay? So, I'm going to have to turn this front light off, which is a bit of a nuisance. Does not mean go to sleep, guys. Alright, but I want you to be able to see what's happening here. Alright, embryonic development. So, the baby, the thing, the blob, is an embryo from the point of conception until we hit 8 weeks. Right? And what is going on during that time is massive cell differentiation to start forming specific tissues and organs. Okay. And, you know, we get 23 chromosomes from each parent holding genetic material. So once those join, then we've got a cell with 46 chromosomes, and that cell has to divide. We have one cell. That cell has to divide very rapidly to become anything other than a cell. Okay? So by 3 days, we have about 32 cells. By 4 days, we have about 90 cells. So these cells are differentiating, they're splitting and forming new cells at a very, very rapid rate. And most of that initial differentiation is occurring in the fallopian tube before the clump make it into the womb. Right? So it doesn't get to the uterus until about day 3 or day 4, and then it starts to attach to the wall of the uterus. We start to see limb buds, things that are sticking out of the wall, by about 4 weeks. All right? And we see something that is recognizably starting to be a baby by 8 weeks, so by the end of the embryonic period. At 4 weeks, we have something that's about 1 inch in size, and it's starting to become crescent shaped with these limb buds. Heartbeat, somewhere around 18 to 22 days. Right. And the organs are beginning to develop. So you start to see shadows where the eyes are going to be. You start to see something that's going to turn into the spinal cord. Okay, so here's 5.5 weeks. Still an embryo, but you can see here's head, here's an eye, spinal cords around the back there, here's a little limb bud. So it's got like little hands sticking out of its shoulders, doesn't have any arms yet. Okay, lots of brain development going on. Okay. And some leg buds further down that don't tend to be as developed as the hand buds, and it's kind of like a big raisin at this size. So 6 weeks, so here's coming, the baby's curled forwards. So here you can see spinal cord, right? And you can see the limb buds here. And here's the amniotic sac and the placenta and the yolk sac. Right? So oftentimes we don't even know it's there at this point unless we were planning for it. So that can cause problems. So at 8 weeks, then we start to see the beginning of bone development. All right? So hopefully you can see these shadows in the legs. All right? And the shadows are a clump of cells that are going to be bone. They're cartilage cells, and they're going to turn into the leg bones. Right? So they're called primary ossification centers. This is the place where the bone will start to grow from. And you've got primary ossification centers in the long bones of the feet and in the bones of the toes. So we've got the shape of the toe, but there's no bone there. We've got the shape of, at least the start of the shape of the leg, but there's nothing there. There's no skeleton there yet. Okay. So get to 8 weeks. If it gets as far as 8 weeks, then it's now classified as a fetus, not an embryo. Okay? So the fetus classification lasts all the way through until it's born. And Again, lots of growth going on, obviously, and we see technically two terms. If I'm increasing the number of cells and growing by adding more cells to the body, that's hyperplasia. Hypertrophy is the cells that are laid down have to get bigger. Okay? And what we see is a directional law that we have, and we see this a lot when we're looking at motor skills. So the directional law for development is very obvious when we're watching this fetus grow, but it will also be obvious when we're looking at skill development. So growth is Kepler-Caudal. All right, I grow from head to toe. Kef, anything when you see Kef at the word means something to do with the head, with the brain. Okay? Kepler-Caudal, head to toe. So I grow from the top down. And proximal distal, I grow from the midline out. Okay? And as I said, when we're looking at skill development, the directional laws still play a role. I learn to move my head and my shoulders before I learn to move my feet. Right? I move my shoulders before I move my fingers. So we're going to come back to these terms again when we're looking at skill development in a few class time. And although cells differentiate very early in the womb, so they start to become a particular type of tissue, there's still quite a large degree of plasticity. That means they're capable of doing another function if they need to. All right? And that doesn't happen a lot once we're old. You know, tissue cells can't, my skin cells can't become lung cells. But at this point, they can switch jobs if they need to. So at 11 weeks, now, placenta's in place. It's not using the yolk sac anymore for nutrition. It's getting everything it needs from the mum. And this picture gives you a good example of this idea of Kepler-Caudal. Here's the great big brain, and here's the tiny little feet. Right? So at the moment, most of the growth is going on in this brain. All right, here's the placenta. This dark spot here, I'm not a baby person, so this isn't my area of expertise, but I would say it's probably stomach or liver starting to develop. All right, again, we can see things that are going to be eyes. All right. So, oxygen for the baby to make energy to grow, and nutrients are now moving backwards and forwards from the mum to the baby. All right, so child is now totally dependent upon the health status of the mum. All right. So, abnormal prenatal development. What can happen here? Okay. Genetic abnormalities can occur because of a mutation in the gene. So sometimes, unfortunately, when the information from the mum and the information from the dad join, something goes wrong. And the gene is disturbed, and so what it drives, the development it drives, is incorrect. Right? That can happen. Sometimes some of the genetic material from one parent or the other already carries something that is incorrect. So it carries some congenital problem, So it might have a recessive gene for some disease, and if both parents carry the recessive gene, then the child will be at risk of developing that disease. Right? So there's lots of genetic things, and it sounds scary, but actually the incidence of genetic abnormalities in births, when you look at the entire population, is very small. It's less than 4% of the population. So it's really unlucky if that happened. Extrinsic factors can affect the fetus through either the mum's nourishment or the environment. Right? So these extrinsic factors are called teratogens, substances delivered through the nourishment system, through the placenta to the baby, that impact the baby's development, right, in a negative manner. Okay. So a teratogen is this negative impact, and teratogenic effects are going to result from timing and from amount. All right? Usually it's because there's too much of something that shouldn't be there, but it can be because there wasn't enough of something that should have been provided. And this can occur because the placenta isn't a perfect screen, right? Some things can get across the placenta that we wouldn't want the baby to be exposed to, right? So large viruses can't get across. Something that's smaller but still harmful might be able to get across, right? Other ideas: pressure, temperature, X-rays. So when you go to have an X-ray of any kind, always, 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 you are asked, doesn't matter how old you are, how young you are, always the first question is there any possibility you could be pregnant? Obviously not if you're a guy. But the girls in the room know what I'm talking about, right? It's always the first question, because they're not going to want to give you an X-ray if there's a possibility you could be pregnant, because X-rays are harmful. Right? They're not safe, whatever people try to tell us, right? And a lot of X-ray on something so tiny could impact the baby. And the issue occurs when we're looking at what tissues are developing at that time, because all the tissues develop within their own timeline. So sometimes you could expose the baby to something and it would have an effect, and other times it won't have an effect. Right? So what's the time of exposure, how much exposure, and how vulnerable was the tissue at that time? So this chart gives you an idea of what tissues are doing what when. All right, so here's lips. So the dark line this is the period of the most vulnerability. And this is when it stops developing. All right? So there's lots of things. You guys are young and you don't see thalidomide people, the children. But when I was in school, we had a couple of kids in school who were thalidomide. So in the 50s and 60s, doctors used to give pregnant women a drug to calm them down because they were being hysterical. Well, then a lot of babies were born with thalidomide, which is a disorder where the humerus doesn't grow, and so the bottom arm is generally very short and the hands So their hands are very, very close to their shoulders. Okay? And there was a whole rash of that. And they worked out, finally, that it was this drug that they were giving to the mums. Depending upon the timeline of the drug, it affected the growth of the humerus. Okay? Well, the baby lives, but its whole life is here now. Imagine trying to run your life with your hands here instead of here. Imagine the impact on what you could and couldn't do with your life. How independent can you be? Right? What options do you have for playing sport or being physically active? How are you going to write in school? Right? How are you going to dress yourself? How are you going to clean your teeth? Imagine the impact just that drug had on all those children's lives. Luckily, they found out it was the drug, they stopped giving the drug, and you don't see thalidomide children anymore. Okay? But it can be pretty dramatic if we do it wrong. All right? So that just gives you an idea, because as I said, what you've got to pay attention to is it depends how sensitive the tissue is. German measles is an issue because they'll tell you if you get pregnant that if you know anyone that gets German measles, stay well away. Because if you are in this period of the pregnancy, then catching German measles can cause the baby to be born deaf. Okay? If you're in this stage of the pregnancy, catching German measles isn't going to affect the baby. Right? Depends where you are and what is developing at that time. So there's another PowerPoint. When you go to Blackboard, there's a PowerPoint that is prenatal concerns, I think the title of it is, and that's another lecture where I concentrate on teratogens and the effects that they can have and the different kinds of substances. So you'll be able to find that and have a look at that, please, so that you get an idea. What are some substances pregnant women are told to avoid? So just generally, what do you know that women are told not to do when they're pregnant?
Drugs.
Alcohol, smoke, drugs. All right, so alcohol is, has, I don't think we don't, I'm trying to think. There's going to be some new kids that I don't know, but out of the kids from last semester, I don't think we had anyone who was distinctly fetal alcohol syndrome, but we did have one the year before who was definitely fetal alcohol syndrome. Children who are born to mothers who abuse alcohol, and that's not one drink a week, right? That's a lot of alcohol, are born with slightly different facial features. Their eyes tend to be quite slitty and narrow. The fold of skin under their eyes is a little bit bigger. Severe cognitive delays. And you also see some motor delays. And they may never catch those up, depending upon the degree of impact. Right? Smoking. When you smoke, the stuff in the cigarettes, carbon monoxide, jumps onto the hemoglobin in your bloodstream, and then your hemoglobin can't pick up oxygen. So then the baby is hypoxic. They're low in oxygen because the mum is smoking and all her blood cells are filled up with carbon monoxide instead of oxygen. All right? So the baby then can't develop properly. So babies of women who smoke heavily, often born underweight, their brain size is often smaller for their delivery time. Again, you can see some cognitive delay. The other thing we get with children of women who smoked was they're often susceptible to chest infections. So they get a lot of colds, bronchitis, coughs, things like that. Right? So have a look at that slideshow. It talks about marijuana, it talks about cocaine, it talks about some pollutants in the environment. It's really quite an interesting, looks at aspirin and other drugs that you should or shouldn't take, all right? And hopefully we'll make you realize something we really, really need to pay attention to, because if I go to a party and I get trash, right, then as long as I don't drive, the only person who's going to suffer because I got trashed was me, right? Because I'm going to be sick of it all. Serves me right. Okay, fine. What if I was 7 weeks pregnant or 9 weeks pregnant, but I didn't know I was pregnant because I had unprotected sex, and now I go and get trashed, and I go again to another party the following week and get trashed because I'm a student and that's what we do, right? Do you see what I mean? So you gotta, this stuff is really an interesting perception. And for those of you who want to be parents, it's a really cool set of information because it will make you want to go, okay, I really want to make sure that I know when I'm doing this. I want to stop drinking a few months before. If I'm with a partner who is drinking and smoking, he needs to stop drinking and smoking because I'd like his sperm to be good enough to impregnate me, right? And smoking and drinking affects him as well as it affects me and the baby. So there's all kinds of stuff when you start looking at this information in this area of study that can become very personal. Right? And it could be very useful for you down the line. So I would really recommend that we pull that slideshow and have a look through at some of the other information. What environments or situations are pregnant women encouraged to avoid? Theme parks. X-rays. Hot tubs.
Being by the microwave.
Microwave. Well, microwaves are interesting because I'm a little twitchy about my environment. I'm not very keen on microwaves. I have to say, there really isn't research to show that microwaves are dangerous. It's just me. It's like, that's not natural, and therefore I don't like it because I'm a bit odd about that. But I have not ever seen anything about microwaves and pregnancy. X-rays, definitely.
Gamma rays.
Gamma rays. I don't know what you would get gamma. I mean, because the rays don't come out of the microwave, right? I don't know. I never even had a microwave until I met my partner because I don't use it. I still can't cook anything in a microwave. I don't use it.
If you accidentally put some foil in there, it might get some rays.
Oh yeah. All right. Hot tubs. Temperature increases can be very dangerous for the baby. So generally they're going to say don't use hot tubs if you know you're pregnant. Or turn the temperature down at the very least. Okay? What substances and supplements should you take?
Water.
Definitely stay hydrated. Vitamins, right? Calcium. Lots of calcium because the baby is trying to grow bones.
Milk.
So if you don't give it calcium, it can't grow very healthy bones. Iron,
Zinc.
zinc, all
Bananas.
kinds.
Bananas.
All right.
Potassium.
So you want to, these are questions you should be thinking about. This is why I'll get off my soapbox because that's a whole other
Later.
conversation. I'll shut up now. All right, sorry. You want to hear it? I'm a little bit funny. You might not approve. We don't want to row. Don't have unprotected sex. Okay, I'm off my soapbox. Don't do it. Postnatal development. All right. So I mentioned that we have this overall growth pattern that a typically developing human would go through. And it's S-shaped. So what we have is, if we look at the big picture, right? Okay, so I grow very, very fast during year 1. Right? I grow pretty fast during year 2. And then it starts to tail off and we get to a point where we chug along 5, 6, 7, 8. We generally grow the same amount every year and we put on the same amount of weight every year. Right? So if I'm graphing it, flat lines-ish. I mean, it might go up a little bit depending on the chart, but it's relatively flat compared to what was going on here. Okay? And then we get to puberty and all heck breaks loose. Right? We suddenly grow, we go this way, we go this way, our feet and our hands get big and everything goes a little kaplooey in puberty. And then we hit our later teens and adulthood and we should be doing something like that. If we're looking at a height curve, it will do that until we're in our mid-40s, and then it starts to edge down a little bit. We start to shrink a bit. If it's a weight curve, it should do this. Obviously, that's not what we see in our culture. We see weird things like this going on a weight curve, but there's no genetic reason why we should see that. Right? A weight curve should flatten out and do the same as a height curve. It's much more affected by lifestyle than height is. So big picture, big growth spurt. You can't put a time on this because puberty is different. For a girl, could be anywhere from 10 to 15, even 16. For a guy, it's going to be more like 12 to 17, possibly 18 if he's really a late bloomer. So this second growth curve, you can't predict until you see it start to happen. So, a lot of variety, as we said. We have universality because everybody does this if they're typical, but we've got individuality because when they do it is going to be different. And how long it lasts for and all these kinds of things is very individual. And I just mentioned timing differs between sex. And if you look at page 66, there's a really cool diagram on page 66 that gives you a good visual for proportions. So, when we're born, if you think back to that picture of the fetus, right? The head was very big and the rest of the body is very tiny. When we're born, that's still the case. The head is very, very large on a baby in comparison to the rest of the body, all right? And so you can see the change in proportion as an adult. well, my head is very small compared to the rest of my body. Well, biomechanically, then, this is a completely different picture, right? The biomechanics of this individual and the skill that they're trying to do changes dramatically based on where is the majority of their weight on their body, right? Because if I've got this great big head pulling me over all the time, it's much harder to stand up and walk and do anything than it is when all my weight is down here and I've got big feet to stand on. Okay? So this visual, I think, helps quite a lot when you start thinking about why is this person falling over or not falling over, or right, what is going on with their proportionality that is affecting the way I'm teaching the skill. Okay. Want some more? Want to start on the children?
No,
Very early.
no, good.
We're good.
A lot of information.
There's a lot of information, huh?
Keep it.
Uh-huh.
Hey, I'm ready for that. It's paper for that.
You ready for that piece of paper now?
Oh, this kid.
Where did I put that? Just the last step.
She's getting past
All right, so piece of paper number 2, put your name on, otherwise I can't compare it to piece of paper number 1. Put a number 2